Well, it's an injury that affects both pro and amateur athletes and can tear and really end a promising career for a lot of people. And we're talking about the ACL. It's one of the 4 major ligaments of the knee.
That's right, and our next guest treats this injury and many others. Dr. Kevin Kaplan is with the Jacksonville Orthopaedic Institute, joins us to talk about ACL injuries and how JOI employs a team approach with their patients. And I think anybody who's been in Jacksonville during the Brunel time learned all about an ACL and how it can impact a career. But first, tell us a little bit about yourself and your role there at JOI.
He changed a diaper this morning.
The first thing I say is 6 this morning. I changed a diaper.
Yay! So. See, we, meaning my wife and me, we did this and we changed the diaper.
We take shifts.
Good for you. Congratulations, by the way.
Thank
5
you
months?
Much. 5 months old.
Yay, that's
growing
great.
Every day. So I'm actually a native of Jacksonville, so I was born and raised here and then moved up to New York City for about 10 years. And then went out to Los Angeles and did a specialty training orthopedic sports medicine arthroscopy fellowship, and then made my way back here with my wife and our first baby. So
wow, that's fantastic.
And you're really involved in the Jacksonville community, particularly with athletes.
Absolutely. So I joined JOI about 5 years ago, and we have 29 physicians. So we really do foster a community approach to sports medicine, and we take care of the majority of the sports teams in collegiate, professional, and high school athletes. Just an example, Dr. Longenecker has been taking care of Episcopal High School with Teresa Adams. Dr. Von Thron and the Beaches folks have been taking care of Providence High School. I think he hasn't missed a game in like 15 years.
Oh, wow.
Dr. Pajadas and Dr. Tandern take care of Bishop Kenny, and then Dr. Lucy takes care of Bowles. He's there on many Friday nights. And I've been honored to take care of the Jacksonville Jaguars. I've been with them for 4 years, and this is my first year as the head team physician spot. I have a group of physicians helping me. And then Dr. Bates and I, Dr. Bates is at our Fleming Island office. He's been taking care of the Sharks with me for the last 3 years. So we really have been taking care of a lot of the sports teams around.
Well, congratulations on that new role for you with the Jaguars.
Thank you very much.
And the Sharks do really well.
The Sharks do well. Jaguars are growing, and young team and a very exciting staff, and we're very excited.
They had a great showing against against Denver the other week.
They did very well.
Keep them healthy.
Yes.
Trying my best.
All on you.
No pressure.
Exactly. We'll blame you.
Thank
you. So listen, you have a personal story that you kind of want to tell us about to help kind of articulate your point about ACL, and you also have a model that you kind of want to bring the two together.
Yeah, so ACL is just a basic understanding of what an ACL is. This is a model of a knee. This is the thigh bone. This is the shin bone. The ACL is a stabilizing ligament between the two bones, so it prevents your knee from buckling or giving way. So when you tear an ACL, unfortunately, you can't just repair it or reattach it. You have to reconstruct it. So in basic terms, what we do is we actually drill small tunnels into the bone, so one in the tibia bone and one in the femur bone, and we use a graft. So this is kind of a makeshift graft, but we pull the graft arthroscopically through small incisions in a camera and recreate that new ligament. And then we fix it with screws, and these are the screws we use. This is a technology called biocomposite. There's no metal. Looks like a screw, acts like a screw, but it gets absorbed into the bone over a year or so, and that allows the ligament to heal. So, I wanted to bring patients with me. Kyle and Kevin are brothers. They both live in Tallahassee. Kevin graduated cum laude in 3 years, is working.
Wow.
Kyle's a freshman. Kyle I met when he hurt his shoulder, fixed his shoulder. Then he went back to sports and tore his ACL. So he fixed his ACL, and then his brother about a year later tore his ACL.
Oh my gosh.
Drove back from Tallahassee, and we fixed his ACL as well.
Okay, well, since Kevin and Kyle couldn't be here today doing schoolwork, they've got all kinds of obligations, we put together a short video for you, so take a look at this.
So JOI, through 29 physicians, takes care of the majority of high schools in our area. We've also been honored to take care of Jacksonville University, University of North Florida, in addition to taking care of the Jaguars since their inception in 1995. So it's a big part of our practice, being able to take care of athletes at all levels in the community.
At the beginning of my senior year, I was playing high school football, and I did a quarterback sneak and made one wrong cut, and I felt my knee tear from there.
I was just playing a pickup game of basketball with some friends one afternoon, and I was running and hyperextended it, and I heard a pop, and I think I knew that's when it was torn.
The anterior cruciate ligament can't be repaired. We have to reconstruct it by putting in a new ligament. So in both Kyle and Kevin's situation, we used what's called a bone patellar tendon bone autograft. That means taking a piece of their own bone, a tendon in between, and a piece of bone off the tibia, and using that to reconstruct the ACL. In order to reconstruct the ligament, I drill 2 holes, one in the tibia and one in the femur, and I'm able to arthroscopically, through small incisions with a camera, pull the new anterior cruciate ligament graft through one tunnel into the other tunnel, and I fix those bone blocks with screws. They're in rehabilitation starting 2 days after surgery, getting the motion back in their leg and also strengthening the muscles around the knee while the new ACL becomes part of their body.
It's tough in the beginning, just not being able to take care of yourself, and my brother had to drive me around, drive me to work and everything, so you have to be patient with it, and then as you progress, it gets better and better, and you're able to handle and do more.
I'm doing a lot better now. I'm about 6 weeks into physical therapy, so I can feel my knee feeling stronger, and I think I'm on my way.
I think the technical aspects of the procedure are a very small part in looking at the big picture for an athlete. It involves both mentally preparing yourself to go through a recovery process in addition to the physical aspects of recovering from a surgery. So it involves all of our staff, medical assistants, physician assistants, then the physical therapist and the trainers. So we foster a team approach to getting athletes to return to play.
The rehab was tough, but the people at JOI made it so much easier on you. They made sure everything was okay. They would ice you after everything. They would make sure like your family's all right, and my mom would come back with me every session, and Andy would talk to us, and it was just a great experience.
My knee's doing good. I'm playing basketball and football and working out, so it's definitely holding up.
So Kevin and Kyle both had a very positive attitude, and it made my job working with them extremely easy. They act like they're 6 months out of surgery when they're only 1 month out of surgery. They make me feel good about doing the surgery when I know it's really their body and their ability to push through. It's not an easy surgery to go through, and it's not an easy recovery process, but the both of them have been ideal patients in my practice.
Wow. That's a great video. And really, rehab is half of the challenge. You do half the job, but they've got to do the other half.
Just as important as a surgery, for sure.
So if somebody's got an injury, what should they do?
You can go to joi.net. I also have a website, kevinkaplanmd.com. You can see stories about surgeries. You can see the surgeries themselves, or you can schedule an appointment with us.
See that video that you had with the camera
There you go. You love that one.
That was pretty cool.
You do. That kind of gives me the little bit of the willies. All right. Thanks so much, Dr. Kaplan,
Thanks
for
for
being
having me.
here. We appreciate it. And also thanks so much to Jacksonville Orthopaedic Institute for sponsoring this segment.
And to reach Dr. Kaplan with a question or to make an appointment, you can go to joi.net or call 346-3465.